Interestingly enough, I had a meeting with all of my consultant staff on Friday morning, and that question came up. You know, do we need to start looking at prioritizing who gets ventilator care or not? We certainly have adequate ventilators, and as far as I know at this time, adequate supplies. What we don't have is personnel. I basically said I don't think we were at that point where we had to be making those decisions. But you know, if we get to that point, unfortunately, it's usually not a situation of vaccinated and unvaccinated. It's usually a situation of elderly versus young. You know, in our last surge, we had an outbreak at Fines Institute in a lot of elderly people with a lot of other conditions. And some of them weren't given the opportunity to be ventilated because we just didn't have the capacity. Wow. But the reality of it is, you know, some of these people are bedridden with bed sores, with other serious medical conditions. That's just the reality of day-to-day life in a hospital. But you know, I can tell you, as of Friday, we had, I believe, 7 people on ventilators in the hospital. We have a 9-bed ICU. You know, after that, we have to be ventilating them in other places of the hospital and then putting strain on various other places in the hospital.